Welcome back to the new norm. I'm Dr. Lou Graham. This program is brought to you by Midway Dental and Catapult Education. And openly, this is the first program I'll have done exhausted. I went to my office today to see 6 or 7 emergencies. We spent the first hour going through all of our protocols. And I'm going to tell you, gang, you need to spend at least an hour to 2 hours going through all your protocols, because the new norm is definitely going to be different. And we went from everything from how to put on our uniforms, all our protective PPEs, how to take them off, how are we going to guide through this, how to put on N95s and KN95s. And I'm going to tell you, there's a lot to this. And Keith will post some pictures I sent him. After 7 hours, my face with all the marks, everybody's going to go through this. I'm no hero. We're all going to do this together. But I'm going to tell you what I love today. What I love today was that my patients were appreciative. My patients actually said thank you each and every time. Now, I'm really close with my patients, but I'm telling you, I see people coming together doing this, and I see appreciation, and I see compassion. We're going to get through this. I'm just going to tell you, you're going to need some time. So Sandy, my Midway rep, had a great pearl. When you get your KN95s, you want to make them really tight. And so here's your pearl. When you're putting on your KNs, in fact, let's just do this. Don't watch this. That'll be an ad lib, but when you're putting on your KNs, and I'm not wasting one, I'm gonna show you, it's how do we pull this part so tight? And what we learned today from Sandy was, I would then have my assistant put mine on after I put it, and she ties a paper clip on the back. And I'm telling you, then they are so tight, but I'll still say comfortable. That's how you gotta get that seal. And then you'll do your breath test. And I know I'm not doing a Tracy test yet, but I'm just telling you, there's so many things we're gonna still have to learn about PP and all this other stuff. And I'm really glad I got Randy Smith on. Randy's the tech of techs. He's been with us already once, how to open an office. We're gonna go through questions on now. First we started with how to close offices, sorry. Now we're gonna talk about how we open them. So I got a lot of questions, but Randy, let's start off. First off, welcome back. I know you were driving yesterday and we had to reschedule. What are you hearing from all over the country? What are you hearing?
So we're hearing different things, but a lot of doctors are reaching out and they're asking the techs about calls, and we're asking and we're talking about, when are they gearing up? They're getting PPE, they're getting ready, so they have questions. They want to know about this. So the buzz right now is, from different parts of the country is, how do I, get ready for this, from a service standpoint? And that is, a checklist of going through your equipment so you're prepared and you don't have any, unforeseen, problems if you just go back to work. So you need to go back into your office and go through the checklist that we've created. And if you have questions or concerns, send us a picture, send us a question. We have different avenues of communication. You may not necessarily need a service call. You might just need a quick FaceTime call with one of our service techs, or you might be able to text us a picture. Or if you're uncertain about a protocol for a particular machine, send us that via our text for service, and we'll send you the manufacturer's protocol on what to follow, so you can go through these things in your office and feel confident when you do start seeing patients.
So let me ask you this, and I guess this is my first question. I know what we did, but I don't know if we did it right or wrong. What would you advise a client? Okay, so let's say you're gonna open on a Monday. What would you advise the team to do the week before? That's what I'm assuming you're not gonna go in the morning of and just click on buttons. So no. Would it be the week before? Would it be the day before? Because I think the day before that's too late already. What are your thoughts?
Correct. Yeah, so a good example is we have a customer in Wisconsin who he went in Wednesday, and he found a problem, a big one, and his vacuum wouldn't fire up. So we were able to get the parts next day aired, and we got him up and running today, but that's kind of cutting it close. So I would say if you had a start date of a Monday, I would get in there on that Monday or Tuesday before and go through all these things, because one, you might need a service call, or you might need a part. You need to, run all this equipment, start running sterilizers, and just go through this, startup protocol, so all your equipment's ready to go, from your delivery units to your lights. You have to go through this checklist and just make sure you're ready to go. There's enough stress with the rest of it. You're going to have a lot more stress if you don't do this, and do your due diligence. So it is really important.
So is your checklist, like, I know, obviously not the whole world is a Midway client, but do you have a checklist on Midway so that people can download this and go through all this? Is that right?
Yes, we're going to have a checklist. And then we also have, through our service coordinators and our service techs, we have the manufacturer's protocols, because there's so many different lines of equipment. So what we did is we have a checklist that's going to be available to everybody. But within that checklist, you may have more questions, or it doesn't really cover every piece of equipment in your office. So within that, if you can just send us a picture of the model number and serial number, we'll help you out and answer those questions, whether we need to get you the manufacturer's protocol and email it to you, or we can have a quick FaceTime call with service techs, might be able to walk you through some of these so you don't have unnecessary service calls, because some of the stuff is simple.
Oh, I'm sure, but it's the big problem. We did this a week before, and we had some line issues. So just basically suction line issues. And I am sure you're just going to have issues if you haven't been open. There's no doubt about it. So let me ask you, you brought up this thing. What is waterline shock treatment? I have no idea. What does that mean?
So it's a way to treat your water lines, all your air water syringes, your handpiece lines in your dental units, so you can reduce any and get rid of biofilm. So the goal is, if you shock it, some people are on a regular schedule already. So if they purged their lines when they left, that's great. But it's probably good now to put a tablet. There's a lot of different manufacturers of it, but some of them are a drop, some of them are a tablet. It dissolves in the water, and you follow the instructions per that shock treatment. Some of them you can let sit overnight. Some of them it's 15, 20 minutes. You run it through the whole system, your handpiece lines, your air water syringe. And once it sits for 15 minutes, then you just purge everything out and fill it up with water and rinse everything through, and then you're good to go. And you've shocked that particular dental unit. Now, it's a little harder if you're on city water and you don't have a water bottle system hooked up. That's probably an area of, you're probably going to need a technician to help you with that. There's ways you can do it, but it's pretty easy to do yourself if you're on water bottles.
Water bottles, which we are, but city water, we may need a technician. So let me ask you a question. So I know we got a lot of non-Midway users, non-Midway customers. Still, I know, growing, but can they download kind of your list and things like that? I think we should just be trying to help everybody. That would be accessible to everybody, right?
Yes, it's accessible to anybody. We're here to help. It doesn't matter, who. We want to help, and as different markets go back to work, those markets are going to be pretty busy. So what we're trying to do is, form lines of communication to help you and ease the stress. But it's not about, getting techs out there to do service calls, because we know some of this stuff we could just help you over the phone, triage it, and it could be as simple as that. I mean, you could have a breaker switch that's tripped or whatever since you were gone, and it's as simple as that as to why your vacuum isn't turning on. If your vacuum is seized up, well, that's a different problem, but we can help triage what that problem is, and get a tech to you in the markets that we're in.
Got it. Right, in the markets that you're in, or if it's not working for somebody in the market you're not in, at least you'll give them the advice then to potentially get your tech in there, because this is not just a routine 1, 2, 3 fix. That's kind of what
Yes.
you're saying for sure. Yeah. So let me ask you another question. Okay, so we've been kind of at this since middle of March. What do you see? Are you installing anything new? Are people requesting anything new? We haven't prepped this, so I'm not putting you on the spot.
No,
but
we're
like,
still we're
Yeah.
still installing. Yes, every day.
But is there stuff, what's new? Like, are you getting new requests of something that's new on the market? I'm just curious from the technician side.
Well, a lot of people are asking about the air purifiers. There's a lot of
Right.
questions about PPE, the PureVac for the dental units for hygiene. So yeah,
Right.
our technicians are getting a lot of questions about that, and we're
So,
getting those calls.
That's good. That's good. So everything though really can go from an easy Dentsply PureVac, which is relatively easy, you and I would agree, to the
Yes.
much more complicated filtration systems and things like that. You would again agree,
Correct.
I think.
Yeah,
And so talk to me about, so let me ask you this. I was talking to some friends yesterday and they're talking, and again, I'm not putting you on the spot, but I see after working all day today, it is going to be almost impossible, even with the best PPE precautions, to keep everything what I call aerosol free. It's just, whatever. It's just going to be really, really impossible. So I do see why purifiers or air filtration systems, do you see technicians in your world getting very involved in that?
yeah. I think a lot of doctors, trust their insight, so they're going to ask them what they think about it. And from, the Novaris, it's a pretty simple install in the office and not much maintenance on their part. So I think that's
Right.
a great product that the doctors are going to like. From a standpoint of the PureVac and the aerosol, well, that cuts
Right.
way down on the
Right.
the aerosol, for the hygienist.
Right.
There's even talk of so if you have an older vacuum and you're not putting out as much, HV or
Right.
inches of mercury, if
Right.
you had a better vacuum and you were getting better suction, well, you're going to eliminate some of that aerosol. So if you have an undersized vacuum, maybe you got to look at putting one in there that is more effective. So you're creating that environment for less aerosol.
Yeah, I think this is a key point, because every dentist out there knows when they're using high speed, they're drilling, and all of a sudden that suction system isn't really sucking in that aerosol or the debris as fast. You can kind of hear it. It's just how dentists are. We get quirky like that, but the assistants are quirky too like that. So it could be the line, but you're saying it could also be like just a weaker vacuum system that may need to be updated. Is that what is it usually the line or the vacuum overall? I'm just curious.
Yeah, it could be both. If you have your lines are not completely cleaned out, or that reduces flow, and that's how vacuums
Right.
work. I mean, they have to have good
Right.
flow. So
Right.
your lines need to be clean, and we need to make sure that you have a healthy running vacuum, and working to the capacity that it should for your dental
Yeah.
office.
So let me ask you a question. So let's say your vacuum's working. Dentists don't like to spend a lot of money on vacuum systems, trust me. But how much more aerosol would be kind of sucked up with a great vacuum? I mean, is it like almost double? I mean, is it substantially different? I'm just curious. I know I'm not asking you for a study, but would it be?
Yeah, I think if you had a poorly functioning vacuum as opposed to one
Yep.
that's working, I would say you're going to see, probably 25 to 50% difference. If you
Wow.
have a wet ring pump
Wow.
that's running at, full capacity at 12 inches of mercury where it should be, or you have a guy who's got one that's running at 8, and as soon as he opens a couple HVEs, it's running at 5.
Yep.
Well, it's
Yep.
not. You're not going to get any of that aerosol. It's going to go away.
Right, and I guess here's my thing. I know these external air systems are coming out. We got called to Catapult today to evaluate one, but you got to get the stuff out as much as possible on the inside before even dealing with the outside, because openly, if I can suck up 90% inside, then if the available 10% is sucked up externally, I think I can live that way, I think. But if I'm only sucking up 50% inside, I think that's a huge problem.
Yeah. And if so, you know, it's all about maintenance. It's all about running the treatment through your
Okay.
lines, an enzymatic cleaner on a regular basis through your lines, also cleaning your, you know, the traps in the operatories on a regular basis. All of those things affect flow. You know, and if you do those things, you're going to have better HVE, you know, with that.
So I'm going to tell you this. I really think this is a key point today, because we're talking aerosol, aerosol, aerosol. And I'm going to tell you, after working, and I did aerosol today, there's no doubt about it. I created aerosol. You don't section out a tooth without aerosol. That's all I'm going to say. And I know one of my 2 rooms was not optimal. I could just hear it. And so if they've done everything possible to clean out the lines, they've done the traps, and it's still not great, is that a time for a technician to come out and look at the vacuum? I'm curious.
Yeah, it doesn't take long for a technician to decide whether that is working in, you know, at optimal, you know, an optimal time. So if you could, like if you had a rear cabinet or even a trap that was leaking, you know, all of those things affect your vacuum. You know, so you need to eliminate those things. So you know, if you have a leak at a trap in 3 rooms, well, you're not losing a lot, but you're losing. You know, that is affecting the performance of how your vacuum works. You know, and I've even seen where, you know, some people, you know, they leave a saliva ejector open, you know, just because that's you know, that affects, you get too many open in an office, you know, it's meant to be how many users at a time. So you need to get rid of the leaks. You don't accidentally leave the scavenging on your nitrous. All those things pull away from your vacuum.
You know, I would say this. Everybody's looking for other solutions. I think you got to look internally first here. And I know that I'd rather have the technician, I'll pay the money, have them come out and look to see, because if all my assistants are there and we learn the problems, because honestly, before aerosol, nobody was so nervous about it. Yeah, I know everybody's supposed to be nervous, but before COVID, people just, you know, shook their heads. I think now's a really important time with all the servicing that we're talking about. I think vacuum becomes huge. I know I'm stuck on this. And the filtration. So I'm going to ask you one more question, then I'll let you go. I promise. What about, like, you know, and I'm not putting you on the spot again, but what about treating the water as it's coming through? So one of my good buddies and we were talking about ozonated water yesterday. In other words, should we be treating the aerosol before it comes out, and now we're treating the aerosol when it comes out? Is this a 2-way battle? What do you think?
Well, so the water coming out is, most of them it's already treated in a sense. Like most you're using the straws, or, you know, that water is already treated, you know, in that sense. So I don't really see, I think we, you know, might be going too far on that. I mean, that's just my opinion.
Okay. You know, listen, that's why I threw this out at you, and I'm not saying my buddy's right or wrong. It's just, you know, everybody's just all of a sudden with COVID, everything has blown up with thoughts. And, you know, who was thinking of negative pressure rooms and HEPA this or filtration systems? I'm telling you, nobody was thinking this. Wouldn't you agree? I mean, nobody was thinking this really January 1st of this year. I mean, that's been a huge change. Right. So I just think it's important to keep our eyes, you know, and our minds open to all these different things, because I think that aerosol system is absolutely important. I mean, when we had NSK on and they're talking about their valves and how it stops things from going back into the lines, I think all these things have nuances that can keep us safe. And that's why I just think it's a kind of, with the new norm, I think we've got to be really looking at minimizing aerosol in every manner. And I think what we talked about already today is one such way. Agreed?
Yes.
Okay.
And
You tell me, anything else? Go ahead.
no, I would just like to say that, as far as, for Midway, we want to be here as a resource, and we believe that we can be here in many ways and not just having our service techs come out, to your office. So it's all about communication. We have the text for service. We have our 1-800 number for, service to call and, just ask us tell us what you're looking for, and if it's a quick FaceTime call with a technician, then we can set that up. It might take a few minutes to get a technician that's available, but if they're willing to, wait 5 or 10 minutes, we can get a technician on the phone and help triage, what they're looking at and determine, is that need a service call, or is it something simple, or is something broke? And if we can determine that it's broken, we need a part, then let's order it. It's all text for service, and pictures go a long ways. And if you get back to the office and you just know you need a few parts, you can text us, through our text for service, what that is you're looking for, and we'll ship it right to your office.
Yeah, I'm telling you, everything that's digital in my office with the helplines when we're digitally scanning and something's not right, or our CBCT, not our new one, not our present one, but our old one. I mean, it's really, you don't want to just count on reps. I love all the serviceability online, and if it's a good serviceability, it really works well. I hear you.
Yeah.
Randy, thanks for being on the show. I hope we meet in really much better times.
Yes.
Thank you, Randy.
In due time. Thank you, Lou. Have a good night.
Thanks, pal. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.